Is your back pain really just back pain, or is it more a reflection of your mental health? Recent research is highlighting the enormous impact of mental health on the likelihood of people developing chronic low back pain. Poor mental health has been thought to increase pain sensitivity by recalibrating our nervous system, including areas of the brain where pain is processed. Basically, poor mental health rewires our nervous system to be more reactive to pain, like a car alarm that goes off due to a light breeze. So even when there is no damage to the body, the alarm continues to go off. But the good news is that these factors can be addressed. So let's dive into the individual components of mental health, which can be broken down into 4 main categories. Hey everybody, welcome back for another episode of PhysioShow. A major influence on back pain is a concept known as pain catastrophizing, which is characterized by exaggerated perception of pain threat, feelings of helplessness, and an inability to suppress pain-related thoughts. Is linked to elevated pain levels, greater disability, and diminished treatment response. In a comprehensive study encompassing over 1,000 patients, researchers collected a whole host of data, ranging from personal and lifestyle information to X-rays and MRI reports. And what they found is fascinating. This study revealed that nothing explained an individual's disability more effectively than the presence of pain catastrophizing. Pain catastrophizing proved to be 10 times more likely to explain a person's disability compared to pain alone. And it doesn't matter what type of injury the person had, whether it be surgical, traumatic, or chronic. If there was presence of pain catastrophizing, the outcomes were worse across the board. Which is fascinating, because just think of how often people are asked how severe their pain is, but when are they ever assessed for pain catastrophizing? Now, if you're a patient who has been assessed for pain catastrophizing, or a provider who uses screening tools to detect pain catastrophizing in your clinic, let me know in the comments below. Another frequently underestimated comorbidity is what is called fear avoidance behaviors. This is where individuals misinterpret pain as a threat, leading to avoidance of movement. Although avoiding pain initially is instinctive and protective, prolonged avoidance of pain can result in disuse, which can worsen pain symptoms over time. This inevitably brings about social withdrawal due to reduced activity levels, and can contribute to the body deconditioning and the development of depression. People often get trapped in this vicious cycle of chronic pain and disability perpetuated by these psychological factors. Research has also been demonstrating the influence of stress on pain. Stress is defined as a perception of threat with resulting discomfort, emotional tension, and difficulty in adjustment, and is the common experience for all of us at various points in life. It can be triggered by a variety of things like work, school, or home situations. While many can effectively manage stress without lasting consequences, prolonged exposure can lead to the development of pain, and if left unaddressed, result in widespread and chronic discomfort. Stress has not only been found to be a risk factor for the onset of low back pain, but it also contributes to prolonged symptoms and heightened pain severity. There has also been shown to be significant connections between depression and chronic low back pain, revealing individuals with prolonged low back pain are 3 to 4 times more likely to experience depression compared to the general population. There is also evidence that self-identified depression at baseline has been shown to be the strongest predictor of future reoccurrences of low back pain. So in other words, those who are depressed are more likely to have back pain, and those who have back pain are more likely to be depressed. Depression has also been shown to be associated with heightened pain severity and increased levels of functional, social, and emotional impairments. But despite how obvious the impact that psychological factors can have on the pain experience, they are often overlooked, with patients and healthcare providers alike focusing solely on the severity of pain, essentially hyper-focusing on the symptoms but failing to appreciate the primary driver of the issue at hand. And while physical interventions like massage and joint manipulations can be helpful, these more traditional physical treatments do not address the underlying psychological influences that are often at play in those with chronic pain. This limits the treatment's effect and leaves patients needing to come back repeatedly for treatment with minimal to no long-term impact. Now, the real key is early intervention, where individuals with acute pain are recommended for physical therapy. Physical therapists play an important role in educating patients about pain, helping to reduce their fear of movement, and prevent symptoms from becoming chronic. In those with chronic pain, graded exercise is critical to address the deconditioning that occurs due to disuse and restore proper movement, which is usually all jumbled up due to the years of moving differently due to pain. Mental health providers can also play a vital role in helping people reconceptualize their pain, provide strategies for stress reduction, and manage depression. So remember, pain catastrophizing, fear avoidance, stress, and depression play a huge role in shaping our overall pain experience, especially for those with chronic pain conditions. Disregarding these psychological aspects is like attempting to address a condition blindfolded and with your hands tied, because as research is showing us, low back pain is much more than just the back. Well, I hope you all enjoyed this episode of PhysioShow. You can help support the channel by giving this video a like and subscribing to the channel. It goes a long way in helping us continue to grow and provide you with all the content about your body, how it works, and what it needs to keep moving.